Thank you for having me.
Hello, friends and family. This is Dr. Valerie Mukanga with Healing Wings Dental, which is the place where we help our patients maintain and or regain their oral health and smile so that they can soar in life. And so today, what we would like to do is discuss different things. You know, many people have questions about high blood pressure. And even when people come to the office and they have high blood pressure, and sometimes we're not able to treat them the same day because of that. Some people don't understand and they just think that we, don't care about their time or we don't care about them. But it's not quite the case. So today, I have a very good friend of mine, Dr. Anita Luanga, and she is an MD, and I would like for her to discuss a few things, key things that we need to know about high blood pressure. But before we dive into that, Dr. Anita, I would like for you to please introduce yourself.
Okay, thank you so much, Dr. Valerie, for having me on your show. My name is Anita Luanga. I'm an exercise physiologist, internist, and geriatrician. Internal medicine doctors are doctors that take care of adults, and geriatricians are doctors that specialize in taking care of adults that are 65 years and older. My mission is to keep my patients healthy, active, and out of the hospital by optimizing their diet, their exercise, their sleep, and of course, their medications.
All the things that we need to know about and do on a regular basis. That's wonderful. I'm so glad that you were able to come in to say yes to our invitation. So, Dr. Luanga, please, can you tell us a little bit about high blood pressure? What is it?
Okay, so I like to use an analogy when I'm explaining high blood pressure to my patients. So imagine your body like a garden, and then you try to water the garden. So you have like a piping system. So imagine your blood vessels like as a piping system that goes throughout your garden, and the piping system has little holes. I don't know if you guys have gardens and you know those little pipe or the pipes, I guess, or the watering hose that has the holes in them. So
Mhm.
your
Your
circulation or the
irrigation system.
yes, yes, yes,
Right.
yes.
Uh-huh.
So your blood vessels are a little bit leaky. They're pipes, but they are leaky. So imagine if there's too much pressure in those tubes or the pipes, then the pressure goes up inside and the water has to flow through the pipes faster. So it's kind of similar. Our blood vessels are the same. They actually have muscles inside of them that make them become narrower and wider. So when you have high
Mhm.
pressure in the blood vessels, it can cause damage to the rest of the body. But in terms of defining high blood pressure, your doctor will take your blood pressure by putting a blood pressure cuff on your arm, and they're measuring two numbers. The top number is when the heart is squeezing, the bottom number is when the heart is relaxing. If the top number is greater than 130 or the lower number is greater than 80, then by definition you have high blood pressure. So blood pressure greater than 130 over 80 in general is high blood pressure. If you have other medical conditions, we might be more aggressive in terms of how we treat your blood pressure. But in summary, that is high blood pressure.
Oh, thank you so much. That was very, very a good visual, to understand because I do see the irrigation system all the time, and so that's very good to know. So, how can somebody actually know that they have high blood pressure? Is that something that can be noticed?
That is a great question. So, for many people, they actually don't know they have high blood pressure. They go about their lives, they might not have any symptoms, and suddenly, when they go to see their doctor or their dentist or their optometrist, or even if they're at the drugstore and they check the blood pressure, the number might be a little bit high or the machine might alarm. For some individuals, and this is a situation where we as physicians are a little bit more concerned, people might be complaining, oh, I have a headache, or I'm having some
Mhm.
chest pain, or I'm dizzy. And then when we check the corresponding blood pressure, the pressure is high. So you might not have symptoms, you might not know, or you might have symptoms, and after the symptoms are investigated, then you find out you have high blood pressure.
Yes, this is true. And I like how you say that because I know that high blood pressure is also called the silent killer, right, doctor?
It can be, unfortunately, for some people, it can be. And in some, the devastating cases are where an individual has a stroke and the stroke affects a big part of the brain and they had high blood pressure for years. And if it's a big stroke and they don't recover, then yes, it can be a silent killer.
Right. So because I say that because this is actually something that we experience in our family. I have one of my mother's cousin somewhere in Europe. Actually, one day he didn't know that he had high blood pressure, and he just fell one day, and it ended up being that he had a stroke, and now he's wheelchair bound. So yes, high blood pressure. Yeah. So, what are some of the risk factors of high blood pressure, Dr. Anita?
That's a great question. So, risk factors doesn't necessarily mean cause, but it
Mm,
means that we've done studies and we find individuals that have these other variables in their life tend to have high blood pressure, but it doesn't cause it directly. And we can talk about causes later on. But risk factors, age, as we get a bit wiser in years, we're more likely to find high blood pressure. High BMI. By high BMI, I mean carrying excessive amounts of weight. We find as
mhm,
people are holding onto more weight on the body, they're more likely to have high blood pressure. A family
mhm,
history of high blood pressure. There are some
mhm,
genetic variables that can predispose somebody to having high blood pressure, or it just runs in the family, even if we can't find a gene to explain it. Kidney
mhm,
disease can increase the risk of having high blood pressure. Consuming excessive amounts of alcohol, consuming recreational drugs, especially something like cocaine, it commonly causes high blood pressure. Not being active, meaning you're not exercising very much. Those are the main risk factors for high blood pressure.
mhm. That's interesting. So, because when you talk about the risk factors, and some of them seem to be things that we can actually refrain from doing, and I'm sure we're going to dive into that a little bit later on. But so, what are some of the causes then of high blood pressure, Dr. Anita Luanga?
So the things we found that can cause high blood pressure directly are sometimes things we might not think about. So the reason I say causes is because as a physician, I sometimes refer patients who have many medications and are like, this is not normal, or they have high blood pressure at a young age. And then we have to look for what we call secondary causes, or I think the better word is secondary causes or other things that are causing them to have blood pressure that's so hard to control. So number one in many of our lives is stress. It's not yeah, it's not uncommon for people to say have normal blood pressure and then suddenly their blood pressure is hard to control, and then you start talking to them and you find out there's other things going on in their life, such as say illness of a loved one, workplace challenges, divorce, anything else, any kind of stress can make our blood pressure higher than usual. Lack of sleep. So there is a condition called sleep apnea where people don't go into the proper depth of sleep and or they're not breathing properly. So we actually test for sleep apnea in individuals that have what we call resistant or hard to control blood pressure. Recreational drugs, as I mentioned, cocaine is a common one. Thyroid disorder. If your thyroid, which is kind of like the manager of the body, if you think of your body as a company. So if your manager is too hyper, too excited, making everyone crazy, then your body will function quickly. Your heart rate goes up, and your blood pressure can also go up in that situation if your thyroid is too fast. High calcium levels. This is usually related to a genetic condition called men or multiple endocrine neoplasia. Usually we find it backwards. We find the person has high calcium, they might have high blood pressure, some other conditions, and then later on we find out that they have this genetic syndrome. Um, Hormonal disorders. So I mentioned the thyroid disorder. Another hormonal disorder is called Cushing's, where the adrenal hormones are imbalanced in simple terms. And then even common medications that many of us use, such as Aleve or ibuprofen, these class of medications are called NSAIDs. We find for some people, especially if they've been taking a lot, say they're having knee pain, and then suddenly they start taking Aleve every day or ibuprofen every day, and then they go see their doctor. Their doctor's like, "Oh, now you have high blood pressure."
Oh,
It
wow.
can, yeah, absolutely. It could be just because of the Aleve, ibuprofen, or Advil that they're taking consistently. Oral contraceptive pills are not all of them, but there's specific type that tend to increase the risk of high blood pressure, and not in every person, because I don't want people to
Yeah.
get very stressed out. But this is a potential cause. Decongestants, Benadryl. When I was doing my geriatrics training, I remember my geriatrics attendings or teachers telling me, don't give older patients Benadryl. It's going to make their blood pressure go up. So that is known, especially as we get a bit wiser. Some antidepressant and some weight loss drugs, primarily because they're increasing the metabolism. They're kind of acting not quite the same, but almost like the thyroid, increasing the way the body functions. And as a result, also the blood pressure goes up, especially if these weight loss medications contain caffeine. And
Oh
of
wow.
course, caffeine is another one. Especially if you're one of those people who goes to like Dunkin' Donuts or Tim Hortons for my Canadian friends, and you're getting too much coffee. Like people, like legitimately, people drink quite a bit. I'm probably also in the camp. I should be cutting back, but yeah, drinking a lot of coffee, it can make your blood pressure go up over time.
Oh wow. Wow, that's those are some a lot of causes. A lot of things can actually cause high blood pressure. Wow. And so, doctor, then I heard you talk about onset. So early onset, it's possible for children even to experience high blood pressure.
Yes, absolutely. It's not very common, but it is possible. And in those cases, even though I have to give a disclaimer, first of all, I'm not a pediatrician. I'm
Mm-hmm,
only certified to take care of adults, basically
mm-hmm,
17, 18 years plus. But
mm-hmm.
yeah, in some cases, children can have high blood pressure. And in that case, they would likely be referred to a specialist to try and determine what could be going on. It could be a thyroid disorder. It could be like an adrenal disorder, like Cushing's. It could be something else going on. But it's not very common for children to have high blood pressure, but absolutely concerning if it is found.
I see. So, doctor, I would like to know then, what are ways to actually treat high blood pressure?
That is a great question. So I'm gonna split the treatments up into two categories. So the first one is going to be natural, non-medicinal. I'm not sure what your audience is like, but I do tend to have many patients who are not excited about taking medications.
Mm-hmm,
And even if we are prescribing medications, we should talk about the natural ways, because if we prescribe medicines and the some of the natural or basic things are not taken care of, we might have to keep adding medications. And then I'm going to talk about some medicines that we might use. So one of the things we advise our patients to do is, if they're holding on to excessive amounts of weight, we talk about ways to cut back on our weight
mm-hmm.
through a combination of diet and exercise. We also talk to our patients about sleeping. In this fast-paced society, it's not uncommon for people to feel like, you have to cut back. We have to cut back on our sleep in order to get things
Mhm,
done. So most of
mhm,
us, 7 to 8 hours of sleep. If you're sleeping less than that, even six for some people can make a big difference in your blood pressure. Reducing
mm.
caffeine intake, as we talked about, if you're getting your two extra large coffees in the morning, maybe slowly cut it back, do like like maybe one large, and then you could do an extra large decaf, and then slowly decrease. Because I know it's
Yes.
not practical to just tell people stop drinking coffee. We can
Right,
wean
right,
slowly. Reduce salt intake, so less
right.
than, I think, 2 grams daily, or you can switch to the Dash diet. And there's also Mr. Dash. It's the salt. Is it Mrs. Dash or Mr. Dash? I can't remember what it is, but
I
it's the
believe
salt.
it is Mr. Dash, yes.
Mr. Dash. In this, yeah, who knows? In this interesting world, I'm like, I can't
I see
remember.
Dash for sure.
Yeah. So Mr. Dash, the salt substitute, and over time you can wean yourself off of taking so much salt. So I actually went
Mhm.
through a journey where I changed my diet, and my coach told me, cut back on the salt. And now when I go to restaurants or I eat at other people's places, I'm like, wow, there's so much salt, and they're like, no, there isn't. But you'll
Right.
be surprised how your body gets used to eating less salt.
Uh-huh.
Reducing alcohol intake for sure. Actually, the newer studies now are saying that no alcohol intake is beneficial. We used to talk about one glass of red wine can be good for you, good for your heart. The new studies are saying, if possible, just abstain. So I talked about a lot of things. In summary, cut back on your salt, cut back on your caffeine, get enough sleep, lose weight, and try to reduce or not consume alcohol. If you're consuming recreational drugs, definitely that's a conversation that needs to be had with your physicians, and abstaining would absolutely help reduce your blood pressure. So that's the
Thank you
natural.
so much. Thank you so much. So I know you mentioned reducing weight. Do you think that exercising would help? And if it does, what kind of exercise would be recommended for somebody that does have high blood pressure?
That is a great question. So, to be honest, the weight loss conundrum, it's not as intuitive or as simple as it sounds to actually lose weight. The majority of way we lose weight is by changing the diet. The challenge with exercise, exercise is absolutely important, but depending on what kind of exercise you do and what you're doing with your diet, you might actually not lose weight. You could end up gaining weight. So, for most people, if you're really trying to lose weight, I think something as simple as walking, like especially if you're sedentary, just start with walking. Try to aim for ideally 40 to 60 minutes, 4 to 6 days per week. You can walk in your neighborhood. If you're more tech savvy, you can get like a heart rate monitor, and there's a certain target heart rate. 50 to 70% of your heart rate max is what you want to target. But start with walking. If you have very, very high blood pressure, you should definitely be talking to your doctor about lifting weights, doing things such as lifting weights, sprinting, high interval intensity training. Is because your adrenaline tends to surge when you're doing these workouts. They are very important. We do need to lift weights to maintain our muscle mass. But if you're having very high blood pressures, like 200s, 180s, and they're really struggling to control it, your doctor might want to check your heart for certain things to make sure that the heart muscles are not thickened before they allow you to do that kind of exercise. But most doctors would not have any issues with walking. And then in terms of the diet, in simple terms, eat stuff that comes from the earth.
From the earth.
Yes, somebody, I didn't make this up. Somebody said, does it fly? Does it walk? Does it swim? Did it grow that way? So if you're looking at broccoli, it came out of the earth that way. If you're looking at chicken nuggets, they didn't come out of the earth that way. The chicken breast is more natural, closer to what it came, from the earth from. But the extra stuff, it didn't come from the earth that way. If you're looking at your cereal, oatmeal is more natural. But if you're going to like Fruit Loops, they came a long way to become Fruit Loops from whatever they're made of. So
So you're saying trying to refrain from processed food as we know it.
100%. And on top of that, try to eat like higher fiber foods, healthy fats. This is a long conversation for another day, but in summary,
It is. It is. Okay, and so there you talked about natural ways of addressing high blood pressure. What about medication? Because I remember there was a patient of mine who came in, and we were not able to do her treatment. She told me that she was taking garlic and she would not be taking any medication. She just didn't believe in that. But I believe it was actually 2 days later, she ended up, like, her blood pressure was really, really, really high. And she ended up going to the emergency room because she was so dizzy. She was actually, she stayed the night, and she ended up being on medication. In fact, she contacted me and she thanked me because I had told her that we couldn't do the treatment, but she had to go and see a physician for her blood pressure to be managed.
that is amazing, and that is so wonderful, because you could have, like, something bad could have happened. So probably you saved her life, because imagine if you did the treatment, maybe she was fine and she keeps walking around and not taking something strong enough to lower her blood pressure. It could be fatal. So it's excellent that you told her to go and see a doctor. So in terms of the medications to treat high blood pressure, I don't want to get too technical, but I'll just give you a general overview. There are different medications that do different jobs in the body to lower blood pressure. And in general, we like to start with one medication. And the way we select the medication is we look at you as a person, we look at your age perhaps, and what other medical problems you have. For example, if you have diabetes, we might select one class of medications over another. If you've had a heart attack, we might select a different class of medications that helps the heart, that kind of thing. But in general, one of the types of medications, there are many though, many names and many families. One of the types of medications are diuretics. In simple terms, they make you pee out extra water. An example of a common diuretic people might see is hydrochlorothiazide. It works at the kidneys. Basically, in simple terms, it's like, imagine your kidney like a tap. It opens the tap and makes you pee. So if you have your blood vessels, or like the piping or the tube, if there's less water, then there's less pressure to push against. Another class of medications changes the hormones in the body. An example of this would be something like what we call an ACE inhibitor, like lisinopril, anything that ends in pril. It changes some of the hormones in the kidneys and also opens up the blood vessels so they relax a little bit more. Another class of medications are called beta blockers. So they block some of the receptors in the heart and in the blood vessels. By blocking these receptors in the heart, they slow the heart rate down, or kind of reduce the time that it takes for the heart to push blood out. And by doing that, the goes down a little bit, and they also open up the blood vessels. And then there's some other medications that work in the central nervous system. So the central nervous system is connected to our brain and some
Hmm.
hormones. So there are medications that also act there. So this is just a general overview. We need like a full science class to go over these details. But again, your doctor will look at you as an individual. What are the medical problems you have? And then select the medication that would, in addition to helping your blood pressure, perhaps help treat another medical problem at the same time.
Thank you so much, doctor. I've learned a lot, and I'm sure the audience has as well. Um, I wanted to know if there are some type of foods that can be taken that would be best, as far as someone having high blood pressure.
So this is a topic that I find very interesting. In general, with conventional medicine, we do not prescribe foods to treat high blood pressure, but it is known by looking at the scientific literature, there are some foods that can help or have the same way of acting, or what we call mechanism of action, as
Hmm.
medications. But as physicians, we do not prescribe these other foods to replace medications. I'm just going to give
Right.
you an example of one of these that I learned about a couple of years ago. I don't know if you guys in Congo drink hibiscus tea.
Not in Congo, but in Ivory Coast, we do. They do,
Ah, yeah. So my I
and
don't
I
know
love
what
it.
you love it. Yeah, yeah. So one of my aunts in Uganda is so into hibiscus tea. So I was just like reading about it. She's like, my mom was telling me, oh yeah, your auntie Beat said drink this for high blood pressure, drink this for that, and I'm like, yeah, yeah. And I just happened to look it up in PubMed, and PubMed is legit. But they say hibiscus tea is a diuretic. Basically, it makes you pee. So that's how it
Gotcha.
fixes the blood pressure. But I don't know if it's like quantified. You have to drink X cups of hibiscus tea with like 10 flowers in there to lower your blood pressure this much. But the medications, the thing is with the medications, we know what we're doing with certain doses. We know the side effects. We know how to undo the side effects. But with
Right.
hibiscus tea, I can't, prescribe X hibiscus tea for this complication, and then these are the side effects you're going to have, and this is how we reverse it. So that's why I wouldn't say we recommend medicine, but some medicine do mimic the effects of certain medications.
Well, okay, thank you so much. Because I know that I did hear about hibiscus, and also maybe turmeric or garlic. I don't know, but I've heard of those. So, well, thank you so much. So, let me ask you this: if somebody doesn't take care of their high blood pressure, what are the risks that they can encounter down the line?
That is a great question. And I think that is something that anybody with high blood pressure should be aware of and should know, especially if they do not want to take medications. They need to be aware of potential risks that they face. So, going back to the analogy of the garden, if you have that tubing or piping going through the garden and the pressure is so high so that the water can't actually go through and water the garden, your garden is not going to look good. It's going to have problems. And
All right.
maybe the piping will burst. So some of the side effects we see of high blood pressure in the body, say if we're going to compare the pipe bursting, you can have a stroke, what we call a hemorrhagic stroke, because there's too much pressure in the blood vessels in the brain, as you're mentioning with your uncle.
Yes.
And I'm not sure what kind of stroke it is, but assuming it's a hemorrhagic stroke or he had an aneurysm, it's hard
Hmm.
to say. But basically, the blood vessel bursts, and then the blood ends up pooling in the part of the brain where it should not be.
Hmm.
Um, that's one. Or if the blood vessels are so narrow that the circulation is not going to the brain for a long part of time, that's called an
Hmm.
ischemic stroke. Essentially, a stroke is damage to the brain, and you'll have corresponding damage to the body based on the part of the brain that the body controls. People
Hmm.
can end up with heart attacks. Same thing. The circulation to the heart is not the way it should be. So
Right.
your heart needs a constant supply of blood. If that doesn't happen, that part of the heart can die. And if your heart is not pumping properly and a part of the muscle of the heart has died, you
Hmm.
unfortunately could also die. We need our heart to function properly.
Oh,
In
wow.
less severe cases, people end up with what we call congestive heart failure. Basically, the heart is like a balloon or like a muscle. It should squeeze forward a certain amount of blood. But say if one of the walls is not functioning properly, then the blood
Hmm.
is not going to squeeze forward, and that causes other complications with blood pooling. Some people, if they're even how to put it, less having less severe damage to the heart, they end up with thickening of the muscles of the heart, and over time that can show up with other problems. Other people can end up with eye damage, kidney problems, The list goes on and on. But in general, any part of your body can be damaged by lack of circulation or problems with circulation because the pressure is too high.
Wow. Wow, 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 wow. Nobody wants to end up having a stroke nor a heart attack, let alone die. So, yes, that's something that we should definitely keep in check and keep in mind. There's something that has intrigued me, Dr. Luanga, is that I see some patients when they come, the high blood pressure is high because we always take the high blood pressure, but they say that whenever they go to the doctor, they're whenever they monitor their blood pressure, it is fine. And I hear that there's such a thing called white coat syndrome. Could you talk to us about it? And is there something that can be done about this, doctor?
Yeah, that is actually fairly common because I think for all of us, myself included, when you're going to see the doctor, you're like, what is this person going to tell me? You're anxious. You're like, are they going to give me bad news? Are they going to give me a needle? Are they going to give me new medicine that's too expensive? Or even just, meeting a new person, you're not sure how things are going to go. So a
Right.
lot of people do have what we call white coat hypertension. So the way we figure this out, say for example, I have a patient who has high blood pressure and they're like, no, I promise you my pressure is good, it's not this high at home, but I'm having a number that I have to do something about because it's too high for them. What I tell them first of all is to keep a log of their blood pressure. So if they have
Mhm.
evidence that when they're at home, they're in a relaxed environment, the blood pressure is very good, much better, and we keep seeing this pattern consistently, then yeah, in that case we can prove that they have white coat hypertension. In many instances, some people are honest with me. They're like, I'm not going to take my blood pressure at home. And I'm like, good. At least you're honest. I respect that. We're not going to play games, but I have a way of finding my information. So there's something called an ambulatory blood pressure monitor. It's a 24-hour blood pressure monitor, so that we can make arrangements for the patient to have that blood pressure monitor put on them, and they have it. They walk around with it for 24 hours. They do their regular activities, and there's certain parameters we're looking for. So if the blood pressure doesn't drop a certain way when we're sleeping and relaxing, the pressure should go down, and or it's higher than a certain target. So the target that we're looking for in the outpatient setting when you're walking around is a little bit lower than what we would use to say you have high blood pressure in the office. Then we
Mhm.
know, okay, there is real high blood pressure. Or we can say, yes, when you come to my office, your blood pressure is 160 over 90. And then we did this blood pressure monitor, and your blood pressure was beautiful at home and it went down at night and you're not taking any
Mhm.
medicine. Then yes, we can prove it in that way that you do indeed have white coat hypertension. On the contrary, there's another condition called masked hypertension, where people go to the doctor and for some reason their blood pressure goes low. And
Oh.
then, yeah, then they're like, I swear my blood pressure is high. I'm always taking it. My aunt told me it's high. I went to the pharmacy, it's high. But for some reason, when I come to the doctor, it goes down. So we can also use the same machine or same principles, recording your blood pressure in your own environment. And then also ambulatory blood pressure monitor. If there's that discrepancy, we take the 24-hour period. We take that evidence more seriously because it's a long period of time versus that few seconds where you're in the office and we're doing your blood pressure.
Very interesting. I didn't realize that the opposite was true about going to a doctor where the blood pressure went down. Interesting. Well, thank you so much. This was so informative, Dr. Luanga. I learned a lot, and I'm sure my audience has as well, and your audience as well, Doctor. You have it right. High blood pressure is definitely not something that you want to ignore. There's something that you can do about it to actually reverse the problem or manage the problem. You have natural ways of doing it, you have medication, but you definitely don't want to ignore it because you can end up in a very bad position. So, yes, Dr. Luanga, thank you so much for coming. I would like to ask you, how can people find you, Doctor?
I have to say, first of all, thank you so much for having me on your show. I really enjoyed talking with you. I enjoyed your questions. I'm very honored to be on your show. In
Oh,
terms of
my pleasure.
how people can find me, I'm on all social media sites. I think probably YouTube would be an interesting place if people want to see or hear a little bit more about tips to improve their health. They can
Mhm.
just search on YouTube Dr. Lwanga, or Dr. Anita Anita Lwanga. On Instagram, I'm at Lwanga, LWANGAMD. I think on TikTok I might be at Dr. Lwanga. On Threads, I think Threads is linked to IG, so it's at Lwanga MD. X, it's I think it's Dr. Lwanga. LinkedIn, Anita Lwanga. And I think those are the main ones. I have somebody who's helping me with my social media who knows all these things, but yeah, I can be reached on. Oh, and TikTok, yes, TikTok. And that one, it's
Dr. Luanga,
yes,
you're everywhere.
I have help to do that. I can't do it on my own. I definitely have help.
Well, that's good because what you're actually talking about, your calling is very necessary. So it's good that you're everywhere so that people can actually benefit from what you bring on the table. So on the flip side, if you are in need of any dental treatment, I am Dr. Valerie Mukanga with Healing Wings Dental. We are based in the big DFW, or Dallas Fort Worth Metroplex, and we are located at 4101 West Green Oaks Boulevard, suite number 317. If you'd like to have an appointment, you have any problem that is dental related, we are the place where you can come. We would love for you to strive and find relief. And so you can call us 972-213-0202, or you can find us on our website and secure an appointment at www.healingwingsdental.com. And we are also on social media: Facebook, LinkedIn, Instagram, and YouTube. And you can find us there too by typing either Healing Wings Dental or Dr. Valerie Mukanga for YouTube. So thank you so much for watching. If you like this information or this type of information, don't hesitate to subscribe and also to share this information with your friends and family, because you heard of the risk factors and you know that there's something that can be done about high blood pressure. That being said, we wish you the very best. Be blessed and have a good night. Bye-bye.